In previous MedMastery lessons, we covered wound care for the general population. However, this is not inclusive of different populations that require special considerations. Let's discuss 3 underrepresented groups and how we can adjust our assessment and treatment plans to suit these populations. We'll start with patients of darker skin tones. Many of the traditional wound descriptions do not currently consider the different appearances of wounds across skin tones. This can delay diagnosis and cause underclassification of the injury. This will lead to longer healing times and increase the risk of complications. To avoid these errors, examine the wound bed and surrounding tissue closely. For patients with darker skin tones, the first signs of injury might be hyper or hypopigmentation of the periwound rather than erythema or redness. Also, moving a gloved finger from injured to non-injured areas of skin and back again may reveal changes in the texture that are not visibly obvious. There is great value in getting a good medical history from your patient. They know their body the best, so ask which changes they've noticed. Additionally, there are devices that can detect differences in tissue temperature or oxygen levels, which may help you assess wound development that presents differently than it would in those of lighter skin tones. Monitoring patients more often than once per week may also reduce the delay in diagnosis. Telehealth and remote patient monitoring can make assessing wounds easier. Our next topic is pediatric patients. This population is unable to provide consent, so permission to treat must be obtained from the parents or guardians with a clear explanation of goals and risks. Also, their skin is still developing, so their ability to thermoregulate and maintain moisture is decreased. For this reason, try and limit the time you spend exposing the wound while you examine and treat it. These patients may also struggle with or be unable to communicate their pain level, so pay special attention to cues such as crying, grimacing, and flinching. You may even need the assistance of anesthesiologists or pain management specialists to fully evaluate and dress wounds while minimizing distress and discomfort. You could even consider using distraction techniques such as games on a tablet or virtual reality tools. Dressing selection may also be challenging. You'll need to choose options that are as comfortable as possible and not easily removed or dislodged. This may require anchoring the dressing to non-affected areas, such as securing leg dressings around the torso. The final population we will discuss is patients in palliative care. When the goals of care shift from healing to patient comfort, a palliative care approach is used. This is not just limited to end-of-life care or hospice care. Frequent conversations with the patient and their caregivers are focused on pain management, odor reduction, and overall well-being. In these patients, a multidisciplinary team will be used to address not only wound care, but all domains of pain or suffering. As the wound care provider, you can help by making sure that dressings that can be worn for extended periods of time to reduce the frequency and pain associated with dressing changes are utilized. Each patient will have different goals for themselves. For this reason, it is important to have a discussion with the patient and their family about specific goals of care and preferences before performing interventions such as sharp debridement and antibiotic use. For more details on how to care for this patient population, check out the Palliative Care Essentials course as well.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope to see you again soon.